Hi guys, today we are going to look at respiratory system, but we have to look about breathing and respiration. We have to differentiate the two. Breathing is the movement of air in and out of the lungs, while respiration is the exchange of gases between the body cells and within the internal body environment. We have the muscles of breathing, that is the external intercostal muscles, and the diaphragm. Those are what we are going to talk about during breathing. Under internal intercostal muscles, we have the external intercostal muscles. These are involved during inspiration, and these internal intercostal muscles, for them, they are involved during expiration. Now we are going to see what happens here during inspiration and expiration. So we are going to talk about during inspiration. Remember, we are talking about the intercostal muscles. During inspiration, the external intercostal muscles are to contract. As you see, if they contract, then the chest will expand. As you see this arrow here, so the chest will expand when the intercostal muscles have contracted. Then the diaphragm will move facing down. That's the diaphragm. Then ribs these ribs will move upward. Will move upward. That's during what? Inspiration. That's how the intercostal muscles do. So that's all about inspiration. Then during expiration, when you are expiring, then this is what happens. The internal costal muscles will relax, then the chest will recoil. As you see, if you are to observe clearly, this is, are you seeing these dots, these ones, this is when the what the chest expands. So here, if you are trying to see, we are seeing the chest is moving back. Are you seeing? The chest was here, then during inspiration, then after expiration, then it has moved. Are you no? And I'm seeing now, you can observe clearly. So after the chest coiling, then the diaphragm, this diaphragm, as you see these arrows here, if you try to look at these arrows, the diaphragm will move upward. Yet here, during inspiration, the diaphragm moved downwards. As the ribs are doing what? Moving up. Then here the ribs are moving down, yet these ones are to move. The diaphragm is to move down. Those are the arrows. If you can try to see, and you differentiate the two. No, but don't. This one may confuse most of you. Like the breathing cycle, the breathing cycle. So this is not the breathing cycle, but I'm trying to show you how intercostal muscles work. Right now we are on the diaphragm. Now we are done with the intercostal muscles. The diaphragm is a dome-shaped muscular structure separating the thoracic and the abdominal cavity. It forms the floor of the thoracic cavity and the roof of the abdominal cavity, and consists of a central tendon. A tendon, it joins a muscle to a bone, from which muscles fiber radiate to the attachment of the lower limb and ribs and the sternum, and to the vertebral column by the two carrier. What are those carrier here? If you try to look at the courier, it's here, as you can see. This is what we are talking about. This one, this one, uh, between the courier. When the diaphragm is relaxed, the central tendon is at the lower at is at the level of the eighth thoracic vertebrae. When it contracts, its muscle fibers soften, shorten, and the central tendon is pulled downward to the level of the ninth thoracic vertebrae, lengthening the thoracic cavity. As you've seen, yeah, this decrease pressure in the thoracic cavity and increase the abdominal and pelvic cavities. The diaphragm is supplied by the phrenic nerves. By phrenic nerves. Yeah, that's what you have to know about the diaphragm. Yeah, though you can go on and read about more about the diaphragm, but you have to just understand and you pick up only the concepts. That's what we are looking about here. So in anatomy, we don't gamble. So you have to just to differentiate. The problem is here. Most of you will confuse these intercostal muscles with the breathing cycle. Just here we are trying to show you how those muscles do work during inspiration and expiration. As I told you, you will look at these pictures to differentiate the two. The intercostal muscles, yeah, you have to look, you have to not to confuse these things. Should not confuse you members. The two. That's it. Thank you for listening, and don't forget to subscribe and comment each and everything. So thank you and nice day. We shall have another lecture. Then we shall be talking about the breathing cycle. But you have to first understand those are the basics, because those are what we are going to use during breathing cycle. Yeah, over mechanism of breathing. Those are the words we are going to look at. Those are the words we are to use. The very one, if you can try to remember, those are the very one we are to use. So thank you for your time. Don't forget to subscribe on my YouTube and comment, like, and you forward. Yeah, nice time.